Now, we are going to see another important topic, that is the recent advances in pit and fissure sealants. So, you have fluoride releasing sealants, colored pit and fissure sealants, fluorescing pit and fissure sealants, moist bonding pit and fissure sealants, hydrophilic fluorescent BPA free pit and fissure sealants with ACP, pit and fissure sealant with SPRG filler, glass carbomo as pit and fissure sealants. Fluoride releasing pit and fissure sealants, manufactured by adding fluoride releasing particles to resin based sealants to prevent caries, contain either soluble fluoride salt such as sodium fluoride or fluoride releasing glass filler or both. Greatest amount of fluoride is released within 24 hours of replacement and it is called as a burst effect. There will be reduction in fluoride release thereafter. Examples are Sealrite, Fluoroseal, Conceal F, Delton Plus. Sealrite and Delton Plus examples can be seen here. Colored pit and fissure sealants, they change their color on curing phase or polymerization, which facilitates easier and proper application of sealant to the tooth. There are two types. One is ClinPro and HelioSeal. ClinPro changes color from pink to opaque white after being exposed to visible light, whereas HelioSeal changes color from clear to green during polymerization. So colored pit and fissure sealants, that is the ClinPro and HelioSeal. Now fluorescing pit and fissure sealants, they eliminate the guesswork involved in sealant placement, confirming placement during recall visits. A UV light pen is used that puts the UV light and the sealant fluoresces as white or blue color. Fluorescent glow provides clinician for verification of margin, retention and to inspect the margins. Example, Delton Seal and Glow. So this is Delton Seal and Glow. Then you have moist bonding pit and fissure sealants, resin based sealant technology that is developed to incorporate moisture tolerant behavior. Example is Embrace Wet Bond. It has unique moisture tolerant sealant and there is no BIS-GMA or no BPA. Technology gets activated by moisture. They form a unique resin acid integrating network, also known as the RAIN. Moist bonding pit and fissure sealants penetrates into the pit and fissures, provides superior sealing margins, bonds chemically and micromechanically to the tooth structure, eliminates micro leakage, very beneficial in children who have moisture contamination, less technique sensitive, and the example is Embrace Wet Bond Pit and Fissure Sealants. Hydrophilic fluorescent BPA free pit and fissure sealants. You can see the properties there, only hydrophilic, adhesive technology, fluorosis, and it is tezotropic viscosity. Example, Ultraseal XT Hydro Pit and Fissure Sealants. You can see this. And pit and fissure sealant with ACP. ACP is a smart material that is amorphous calcium phosphate. They release calcium and phosphate and remineralize the tooth structure as a natural repair mechanism. They are light cured, referred to as smart material because it releases calcium and phosphate when the pH drops to 5.5 and ceases when the pH rises. Once calcium and phosphates are released, it will neutralize the acid and buffer the pH. Supersaturation of calcium and phosphate ions locally also help in formation of hydroxyapatite. So this is the structure where ACP will form hydroxyapatite. Sealant with SPRG filler. Pre-reacted glass ionomer is used. It enables formation of S, that is a stable glass ionomer phase in the presence of water. It contains 6 ions: fluoride, sodium, aluminium, strontium, silicate and borate. Example is a beauty sealant. This is the example. Then glass carbomo as pit and fissure sealant has powder with particle size reduced to nano size. Has an additional carbon chain with fluoropatite as a secondary filler. Liquid is polyacrylic acid. The major advantage of this material is it is used in pediatric dentistry where there is a lot of moisture contamination and the sealant is moisture tolerant, making it easy for the placement of children. I hope you like this topic. It's a very important topic, that the recent advances in the pit and fissure sealants, both from the theory as well as a clinical point of view. Thank you one and all. If you want more topic, do write in the comment below. Thank you.